Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hi everybody, and welcome back to the Healthy Living edition of KOM News Extra. Testosterone is a hormone. It's made for men and women, but for men, testosterone is needed to form and maintain the male sex organs and promote male characteristics like voice deepening and hair growth patterns. Some consider it a man's mojo, but low testosterone levels can have an impact on a man's love life and lead to a variety of other issues. Express Care's Dr. Jitka Lom is here in studio to break it all down for us. And Dr. Lom, it's a pleasure to have you back. I know there's no easy way to go about this, being a guy myself, because like anytime you have problems of this nature, psychosomatically, it directly attacks your manhood. Oh, totally. Literally and figuratively and everything. Yeah. So when you're dealing with patients, before we get into the mechanics of exactly like, testosterone and ED, how do you as a physician address those with patients? Well, I think you're completely right, meaning it is incredibly important, and it affects men's self-esteem. And I think the thing to understand first is that it affects almost, I think every man in their lifespan is going to have this happen at least once to them, of ED. And it's very common, and it's not a reflection on who you are or how good you are or any of that. It's just usually a question of hormones and health rather than a reflection on your abilities as a human being. So we try to be sensitive to it and understand that lots of help is available, and the guy's in charge. Mm-hmm. Now, of course, because it is, it's our most basic function, which is to procreate. So attacking that, severely emasculates a man, if you will, and then, within his peer group with other men, that also makes him feel like less of a man. Right, that's true. And they also sometimes will experience blame or guilt or make up all kinds of stories of why this is happening, or if their partner or whoever. So there's all kinds of sort of drama that goes along with it, which is not really necessary if they think of it as this is just physiology, something that can be handled the same way that they handle all other things in their life. Okay, well, I want to talk about that, because certainly there are environmental characteristics that contribute to erectile dysfunction, if guys are going through that. How much of it is actually mental, though? You know what? When I was going through medical school, the thing was it's 90% mental, 10% physical. And now we know, no, it's the complete opposite. And it's 90% physical and 10% mental. Of course, if you have anxiety or you're having stressed out, problems, those things will affect your erectile ability. But most of the time, it's actually physical. Physical beginning with things like toxins, drugs, and alcohol definitely affect it a lot. And then other physical problems such as high blood pressure, diabetes, other health problems. The one very simple one is obesity, and that's such a common problem, and men aren't aware that that can affect their erectile function. Mm-hmm. What are some of the other characteristics that, like, if men are watching this right now and they're like, maybe it's not Thursday night and I'm just not feeling particularly saucy for my partner or anything like that, but how do I actually know that these problems compounded may lead to something more serious? Well, there's separate issues. So there's libido, that's your desire. That has a lot to do with where you are in your life, but also with your hormones. Second is your erectile function, and that is, again, a very physical thing of the blood flow to the area, to the hormone levels that you have, and that leads into the third problem, which is your actual testosterone level. Testosterone is what makes you a man. It's normal that as you get older, that drops off, just like it does for women. Our estrogen drops off, and we have less of that. So just as you get older, your testosterone will dip, and you will have issues with hormone, which are not necessarily related to libido. Your desire is just fine. Your erectile function might be just fine, but your hormone level is low. You feel tired. You're putting on weight, especially around the tummy. Your muscle mass is less, and basically your stamina is low. So people will tell, well, I go to the gym and I just can't lift as much, I can't just do as much as I used to do. These are things, and depression, that's the next one that goes with low testosterone. So the way it goes is that, your testosterone dips, you get a little depressed, then your libido goes down, and then your erectile function can also be affected by your weight gain and so on. So there are so many factors that need to be addressed. Now, as a guy, it's very common for us to buy, like the Men's Health magazines and, and read those kind of things. There's a myth, and I'd like you to debunk this if possible. How much credence can you give to the theory about, like, if men are having erectile dysfunction or perhaps low sperm count, changing the type of underwear that you wear from maybe briefs to boxers, so it allows, you know, for a greater airflow, or you're like more freedom.
So that's a great question. Okay, so the whole thing with boxers is if you're, let's say this way, if your testicles are hang outside of your body for a reason, because they need to be cooler than the rest of your body. So if you're sitting a lot, wearing tight shorts, or you're obese, you're kind of warming up your testicles. What's going to happen there is you're going to have a lower testosterone level. That's going to again affect your overall hormone picture, and you may have erectile problems or libido problems as well. So the thing to do is let's exercise, let's get off our butts, and sure, we can wear boxers also.
So that might be something that happened during the sleeping hours.
Yeah.
Okay, well certainly this is a very, very interesting and obviously important topic. So all right, sit tight, because we did have a lot of questions from our Facebook community.
Sure.
So the Good Doctor will be back, and we continue to talk about this very sensitive issue when Healthy Living Tuesday continues. Stay tuned.